May is Skin Cancer Awareness Month, and today is Melanoma Monday. Did you know that nearly 100,000 people will get diagnosed with melanoma this year? Yes, it can be very dangerous and very serious, but it's also highly preventable. Here to talk about it is my special guest tonight. This is Dr. Jody Levine, a dermatologist, director of plastic surgery and dermatology, NYC. Good to have you here, Dr. Jody.
Thank you.
Good subject, very important, very timely. You know, when I heard this number, 5 million cases of skin cancer a year diagnosed in the U.S. alone, that's an eye-opener, isn't it?
It is. Skin cancer is the most common form of cancer in the United States, but the majority of that number is non-melanoma skin cancer, which include basal cell and squamous cell carcinoma.
See, that's important, you know, preventable, right? But early detection, I know, is important. Tell us about that.
Early detection is key. You want to find the skin cancer when it's most treatable. So I encourage everyone to do a self-exam and let your doctor know if you see anything new or suspicious, anything bleeding, itching, or changing. And of course, visit your dermatologist once a year for a skin test.
And that does make a big difference, right? Just looking at your skin, just checking yourself out.
Definitely. Do you know that about half of melanomas are self-detected?
Right. Very good. Okay, now let's talk about helping people out. There are things that we have to do, and mostly you got to protect yourself from that beautiful sunshine that we're all crazy about, right?
You do. Even though the sun feels great, when the sun is at its strongest between 10 a.m. and 2 p.m., you really should seek shade as much as possible and wear sun protective clothing, lightweight long sleeve shirts, pants, wide brimmed hat, sunglasses, and of course generously apply broad spectrum water resistant sunblock.
You know, a lot of people say, well, you're the doctor, right? But SPF 30, right? But I think that 50 is good too. I use 50 a lot. I think that's very good, isn't it?
Yes, we say SPF 30 or higher.
Or higher.
But no one really uses the required amount. Most people use 25 to 50% of what you should use as far as sunblock goes, and you get much less protection when you use less. So I think a higher SPF is better.
You're also saying that you have to put this on if you're going out in the sun. What is it, 15 minutes before?
15 minutes before. You want to give it time to actually absorb into your skin and work.
You know what, doctor? A lot of people are addicted in many ways to tanning beds.
Yes.
I know that's very, very popular. Talk about that a little bit, because that's something that, you know, perhaps a lot of us, think about. I don't do it, but a lot of people think about it.
It's upsetting. The tanning industry is an over $5 billion industry.
Huge.
Huge. And teenagers are tanning. It greatly increases your risk of skin cancer and melanoma. And UV exposure from the sun or tanning beds is the #1 preventable risk factor for skin cancer.
Okay, so we have to be careful, watch out, you know, make sure you use enough sunscreen, enjoy the sun, but we also have to remember that you can be treated for this, right? In a nutshell, any last-minute advice for us?
Last-minute advice is just stay away from the sun if you can, but when you're out there, use your sunblock, apply it in time, and visit your dermatologist once a year for a skin check.
All right, Dr. Jody Levine, thanks so much.